Hello, everyone, and welcome to Maribella's Voice. We are going to talk about so many things. Today, we're going to talk about the PPP, the second stimulus, the EIDL, and we're going to talk about an issue that is affecting a lot of parents about reopening schools in August. Should you take your kids to school or should you do virtual learning? This and so much more on Maribella's Voice. So make sure you subscribe to the channel if you haven't already done so. Hit the notification button down below so you know every time a video comes out. PPP loan has been a very great loan that has helped a lot of businesses not to go down. But I'm going to ask you this question. What happens to the businesses that were not able to get the full potential because of their credit? Isn't this a disaster? What happens to those people that need that help and weren't able to get that help? Or maybe they got such a low amount because they didn't qualify for the actual loan. So what happens to these businesses? Do they actually go down? Do they have to close their doors? Do they have to sell their business? How can the SBA help the minority business, the ones that have 10 or less employees? How can we help them? And these are all questions that we need to address.
Have been consulting over the last few weeks.
top of the economic impact statement I just gave. So we want to continue to help the unemployed, but we want to encourage work. And we've learned a very tough lesson that when you pay people not to work, what do you expect? And so this payment will be adjusted so that we have additional payments to help people for approximately 70 to 75% of their income. Sounds just like mine. We're going to have further tax relief for businesses, encourage hiring and rehiring, and we want to do that to encourage people to get back to work and help the employer in the process of income. Support patients, nursing homes, and also foster youth, flexibility in how state and local governments can use federal relief funds, including inability to use funds to cover revenue shortfall. And somebody doesn't want me Lastly, I hope the Democrats will come to the table and work out bipartisan.
Well, we all know this is round one. We believe that the leader said, Senator Bradford and others say, this is for the American people. Help get them back to work, people at work, get them back to school, people in school as safely as we can. We've already put out a lot of money. These are extraordinary times. I know the House has a bigger figure than this, and this is something we'll have to work through. Overall, we think this is a pretty good package, and we hope that the Senate in a bipartisan way will move forward.
Thank you. Most of the things in our bill have meaning when added to Senator Blunt's appropriations bill, so I'll just speak about three. Student loans, school choice, and child care. In March, Congress agreed that 43 million Americans who have a student loan would not have to pay a monthly payment on their first payment would be deferred. Still owed, but deferred. October 1 is just around the corner, so what we're proposing is if you have no income, you have no monthly payment. If you do have income, then we'll change the student loan payment system so that you never have to pay more than 10% of your income after you deduct necessities. Second, on school choice, there are about 135,000 public and private schools and 135,000 private schools in the Dallas There's 50 million children in the public schools, 5.7 in the private schools. Generally speaking, we think every child is equal. So what we propose is about $70 million for kindergarten through 12th grade and $34 billion for college. That amount of money for education is about the same as the House passed bill. So there could be an area of agreement. Senator Blunt would say we believe that every school should have some, would be about $12 million per person per K through 12. Every school should get a third of that, even if they're opening virtual. And the rest of that money should go to schools that are making an effort to open as much as possible with students physically present. There are many more expenses when you're physically present. Buses, more teachers, more space, protective equipment. They've got to pay for that. School choice, Senator Scott has a bill which he will discuss, and I'm a co-sponsor
would be able to receive a second PPP loan to sustain their employees and to help cover certain overhead expenses. Another important provision allows PPP overhead expenses to be used for renovations that are necessary to comply with CDC guidelines, personal protective equipment such as masks or gloves, and other renovations that may be needed to ensure the safety of both the employer's employees and customers. That will be particularly helpful to restaurants, for example, that are still under strict restrictions. There is also a long-term loan component of the bill that we've introduced, and Senator Rubio is going to explain that. But arguably, this program has been one of the most successful provisions of the CARES Act, and I'm delighted that we are introducing an extension of it today. Thank you.
One thing, the last time we didn't know much about China. So what have we learned? 90% of the protective equipment that our doctors and nurses and healthcare professionals need to keep us safe. So President Trump is hell bent on trying to bring the supply chain back. There's a big step forward. We have a $7.5 billion tax credit that incentivizes PPE material to be made in the United States. Gloves, masks, gowns, sanitizers, bedding, $7.5 billion tax credit modeled off the energy tax credit that bring the supply chain back. I think the very amendment, there's a requirement that American military uniforms be made in America. PPE under that, so the national stockpile and protective equipment made in America, and we don't have to depend on China. Senator Cornyn has a Chips for America Act. We've lost the semiconductor industry, all left, and we're trying to bring it back. Taiwan being the big investment in Texas. We're going to give tax credits to make semiconductors here, which helps you in another way. Senator Portman's got a bill that I think is much needed to punish people who steal intellectual property in America. We're creating a security council around research and development, penalties for those bad actors who try to steal their way to success. Finally, Senator Murkowski lives in Alaska. There are a lot of precious, critical metals and materials that America has, but we do a very poor job of getting it out of the ground in an environmentally sound way. We're more dependent on China and other places in the world for critical minerals. We've got a plan to become more American there.
I think about 25% of the labor engaged in education We have 20, we have $16 billion, which is a total of $25 billion for testing. Our priority to help testing through the states is to put a priority on elementary and secondary education. that,
I think Senator Collins already outlined. Let me just say that. From that deduce how difficult it's going to be for many of them to survive, not to mention have access to regular capital markets. So as part of this plan, in addition to PPP, there was a loan targeted at low-income census
public awareness. One is, as a result of the COVID crisis, we're seeing the trust funds for Medicare and Social Security approach insolvency at a much more rapid time than we anticipated. And secondly, we're adding a lot
Florida has become the epicenter for the virus.
Thank you, Mr. President. Thank you, sir. A lot of Americans, though, may be surprised at your change of tone over all of this, a more perhaps realistic tone. Some would look at it that way. The sudden embrace of masks, social distancing,
Well, I've always agreed with that. I mean, I've never fought either one, but certainly social distancing. That's common sense. 6
idea
feet
that
to me is common sense. I'd like to say maybe make it a little bit further.
the idea that things will get worse perhaps before they get better here, and perhaps the realization that this resurgence, if you will, is for real when you used to talk about it in terms of little fires being put out here and there. Would you
We have them
respond?
too. No, we have embers and fires, and we have big fires, and unfortunately now Florida is in a little tough, in a big tough position. You have a great governor there. You have a great governor in Texas. You have people that are very, very skilled people, and I think they're going to handle it very well. Their hospital capacities are holding up.
Much uncertainty with things that we do not know. Right now, Dr. Fauci says that we're in the middle of the first wave. Only the middle of the first wave. What's going to happen in the fall and in the winter as the cases keep on increasing? What is it going to lead after? How much more is it going to increase? Is Florida going to hit over 600,000, 700,000?
But Texas is a big state, and it's very well run, and so is Florida, and I think they'll do a very good job.
Changing your tone, though, sir?
Ask you about the issue of vaccines, which you already mentioned. Yesterday, a study by a Chinese company showed some promising results for its coronavirus vaccine candidate. If China were first in developing the vaccine, or even if it were, would the administration be willing to work with China to bring a successful Chinese vaccine to the U.S.?
Yeah, we're willing to work with anybody that's going to get us a good result. We're very close to the vaccine. I think we're going to have some very good results. We're already in testing. Nobody thought that would be possible. Under the old system, it would be a year to 2 years before you could even think about using the word testing. So I think we've had a lot of, and the reason we're testing, they've had good results. So now we have to see in the testing also for safety, because they have to make sure it's safe. And I think you're going to see something over the next fairly short period of time, maybe very short period of time, having to do with therapeutics and vaccines that are very good. So we'll be doing these quite often. We're going to keep you abreast of this, and we'll also talk about some of the other topics like our economy, which is doing well. The stock market had another good day. I think they have a good day because they see a lot of positive things happening on this front too. Thank you very much. Thank you. Thank you.
Communities across America put normal life on pause to buy breathing room for our medical system. We essentially had to winterize the world's largest economy for weeks on end and spare our people as much of the resulting pain as possible. The task was historic, and so was the Senate's response. We wrote and passed the CARES Act, the largest rescue package in American history. Our legislation helped pull both our health system and our economy back from the brink. Tens of millions of jobs were saved. The hallways of our hospitals did not become Italy. The Senate's leadership helped the nation endure the first phase of this, but this crisis is far from over. The virus that has claimed 140,000 American lives has not gone anywhere. Some places step back toward normalcy. Infections are climbing again in hot spots across our country. The start of our economic recovery has been sharp and impressive. But in absolute terms, we still have just begun to pick up the pieces. Our progress so far has been encouraging, but it remains fragile and far from sufficient. I would argue that our country's job now is even more complex than it was back in March. Now, as then, we need to keep our health system robust. But now, instead of locking down the country to do it, we want to stand up a society that functions somewhat more normally at the same time. The American people cannot completely stop building their lives until until the vaccine is available. The United States of America was not built for a defensive crouch. We need to stand up an educational system and an economy that works for workers and families in the meantime. We need to find the right sort of middle ground that is smart and safe, but also more sustainable. So another historic set of challenges, Madam President, and another opportunity for the United States Senate to deliver. For weeks now, I have made it clear that further legislation out of the Senate will be a serious response to the crisis. We won't be wasting the American people's time like the House Democrats with their multi-trillion-dollar proposal to hike taxes on small businesses, cut taxes for blue state millionaires, and send diversity detectives into the cannabis industry. I've said we will start with the facts and develop real, targeted solutions on the subjects that matter most to American families. Well, Madam President, it turns out that means three things: kids, jobs, and health care. Kids, jobs, and health care. Surveys show the American people's top priorities for reopening are child care and K-12 schools. This country wants its kids back in the classroom this fall, learning, exploring, making friends. Their educations depend on it. In some cases, their safety depends on it. And so do the livelihoods of working parents. The American Academy of Pediatrics stated unambiguously that our goal must be in-person instruction. But of course, parents, teachers, and doctors all agree that it has to be as safe as possible. That's where the Senate comes in. And this majority is preparing legislation that will send $105 billion so that educators have the resources they need to safely reopen. That is more money than the House Democrats set aside for a similar fund, by the way. And that's in addition to support for child care needs. It's amazing how you can find room to find serious priorities when you take a pass on the far-left daydreams. Second, the economic slowdown that has hurt millions and millions of Americans. Before this crisis, we had never had 7 million Americans receiving unemployment at the same time. Today, we have 17 million. More than 1 million people have filed new unemployment claims every single week for more than 4 months now. The American job market needs another shot of adrenaline. Senate Republicans are laser focused on getting American workers their jobs back. Our bill takes several specific incentives to hire and retain workers and turn the dials on those policies way up. The legislation will help reimburse for safe workplaces so that Main Street can afford the PPE, testing, cleaning, or remodeling to protect workers and entice customers. The ingenuity and spirit of American small business is impossible to overstate. They still face a tough road. With the majority of businesses expected to exhaust their initial paycheck protection funding this summer, we'll also be proposing a targeted second round of the PPP with a special eye toward hard-hit businesses. And speaking of building on what worked in the CARES Act, we want another round of direct payments to help American families keep driving our national comeback. Helping to create more American jobs is an urgent moral priority. And these are just some of the policies we're discussing that will help that happen. In addition to kids and jobs, our third major focus is healthcare. The reason is obvious. If we lose control of the virus, or if research stalls, then everything else will be window dressing. Our proposal will dedicate even more resources to the fastest race for a new vaccine in human history, along with diagnostics and treatments. Our bill will also protect seniors from a potential spike in premiums. And the federal government will continue to support hospitals, providers, and testing. These are just some of the elements that Senate Republicans are discussing among ourselves and with the administration. But there's one more central proposal that ties kids, jobs, and health care all together. As I've said for months, the next recovery package will include strong legal protections for the healthcare workers who save strangers' lives and the schools, colleges, charities, and businesses that want to reopen. The American people will not see their historic recovery gobbled up by trial lawyers who are itching to follow the pandemic with a second epidemic of frivolous lawsuits. Gross negligence will still be actionable, but we're creating a safe harbor for institutions that make good faith efforts to follow the guidelines available to them. Doctors and nurses clearly deserve this protection, and school districts, universities, nonprofits, and small businesses will need it as well. We want any genuine reopening at all. The legislation that I've begun to sketch out is neither another CARES Act to float the entire economy, nor a typical stimulus bill for a nation that's ready to get back to normal. Our country is in a complex middle ground between those two things. We can't go back to April, and we can't snap our fingers and finish the vaccine overnight. We need to carve out a new normal. So Senate Republicans are continuing to discuss these and other ideas among our conference and with the administration. The majority will be laying down another historic proposal very soon. But here in the Senate, an outcome will require bipartisan discussions. I do not believe there will be anything in our bill that our Democratic colleagues should not happily support. But we will stand ready and eager to work together and produce a bipartisan outcome. As I said yesterday, in March, the Senate gave an historic master class in how to pass major bipartisan legislation. The CARES Act, the largest rescue package ever, was drafted by Republicans, promptly negotiated across the aisle with Democrats, and then passed urgently without a single dissenting vote. But last month in June, we recorded a master class in how not to make a law. Instead of amending Senator Tim Scott's Justice Act, our Democratic colleagues flat out blocked it. They filibustered the issue of police reform altogether. Well, for the sake of America's kids, jobs, and health care, Madam President, let's hope our Democratic friends bring their bipartisan urgency and good faith to the process and leave the partisan poses behind. The Senate has led every step of this crisis. We need to rise to the task one more time. Tweet yesterday with a mask on. It's the single best contribution any of us can make to our family, our neighbors, and our friends. Let's practice social distancing, wear a mask. We are going to have to get through this coronavirus until we get a vaccine.
There's so many issues that are going on that is affecting a lot of people, especially kids. Now, August, school starts for a lot of students, and the question is, are they going to be able to go back to school and be safe, or should they do virtual learning? That's a question that a lot of parents have concerns, and I'm going to show you a few videos, especially here in the state of Florida, about parents and how they feel about it.
And today pediatric infectious disease specialist joining us in just a couple of seconds so that you can answer any questions that you have about sending your kids back into the learning realm, no matter how that's going to be, right, Jules?
Right. We know so many parents have shared with us their concerns not only about protecting their kids from COVID-19 in general, but what to do about starting this new school year, right? And we know in South Florida, Palm Beach County, for example, has postponed their start date to August 31st. They're going to be doing virtual learning. Broward County confirming yesterday they will be doing virtual learning. But with Miami-Dade County, that is still up in the air, as well as the start date that could potentially be postponed. So there's a lot of questions, and we would love to share your questions live with our guest, who is a pediatric infectious disease specialist.
Our expert here today, our pediatric infectious disease specialist, Chad Sanborn. Chad, let's go ahead and bring you into the conversation, doctor. First of all, thank you so much for being with us today.
Great. Thank you very much for having me. Excited.
Thanks. Yeah, we're definitely glad to have you.
First, just let's start off with what you think parents need to know today, with so much that is on their shoulders really in trying to protect their kids. What are kind of the first bits of information that you want to share with them?
Sure. You're not alone in having to make hard decisions in the upcoming months, weeks with your family. Myself, my wife are both parents too, and trying to decide what was going to happen with our children in the coming school year was a topic of debate and not an easily decidable thing, certainly. We live in Broward. There was going to be online learning for our public schools, so our decision was made for us, I suppose. But, I think from a medical specialist standpoint, what we're seeing is that most of the children who get coronavirus infection are not very sick, which is important to remember. So, you hear a lot about hospitalizations and unfortunate deaths in the adult population, and even some of the younger adult population. In children, we're not seeing those nearly the same numbers, which is great. That being said, yes, our kids are susceptible. Even though they may get it less likely than an adult might, they still certainly can get infections. So, you have to know your child if they're particularly rambunctious and maybe it's going to be touching everything and be out and not be able to follow rules so well. Maybe that's not a great person to be in an environment where they can have multiple opportunities for getting sick, or if there's an underlying immune condition or problem, that may also impact your decision in deciding when to go back to school and when school's open.
What about kids' immunity if they, suddenly go back to either a daycare or school setting, what have you?
Yeah, so their immunity should still be good. They they don't lose their immunity, I guess, from being out of school, which is a good thing. The unfortunate thing is you will see increases in other infections as well. Certainly, if there's social distancing in place, kids are wearing masks, there probably will be less common colds, pneumonias, things like that. However, we are likely to see an increase in the common stuff, not just coronavirus in children. In the last few months in all the children's hospitals here in South Florida, for the most part, we did see a dip in admissions because there are less kids in contact with each other and less spreading of their germ from one person to another. So I wouldn't look at the population as being immune damaged or immune suppressed because they've been out of school for so long, if and when they do go back.
Okay,
No,
so
Dr.
that's not.
Oh, sorry. Go ahead.
No, so that's not something that they're concerned about. Kids, the immunity level of kids in general.
Not particularly. I think it will be more impactful to parents. They will say, oh my goodness, my kid's getting sick all the time now. Is something wrong with immunity? But no, you're comparing it to what was going on 2 to 3 months ago when really you were isolating to some extent and other people were as well. So you're going to see an increase in colds, sinus infections, ear infections, same as you would with maybe a little bit less than most other years, but the same as when any school year starts. In the pediatric world, in the offices and in the hospitals, we see less infections during the summertime just because kids are not in that school environment, they're more separated.
Can we say that there's a decline on the way?
Well, hopefully that there's a decline on the way. At the moment, you look at a 7-day average is in general because sometimes you report more cases on one day than another, weekends, holidays, etc. But there may over the last 2 or 3 days or so be some sort of leveling out, at least in the number of cases in Florida. I wouldn't say we're declining at this time just yet, unfortunately. But if people are social distancing, wearing masks, taking responsibility for their health, not going out when they're sick, etc., not letting their kids go out when they're sick, we should hopefully, fingers crossed, see a decline in the coming weeks.
Governor Ron DeSantis has made a case that kids should return to classroom instruction. Let's go ahead and hear what he had to say about that just yesterday.
While the risks to students from in-person learning are low, the cost of keeping schools closed are enormous. I believe we owe every Florida parent a choice to send your child back to school for in-person instruction or to opt to maintain distance learning.
And so, not sure if you could hear what he said at the very beginning, but he talked about when kids go to school that their risk for infection is low. Can you comment on that, Dr. Sam?
Yeah, so from limited data we have so far from places like, Asia, some parts of Europe, we do see that children, some data out of Switzerland suggested that, and France, kids may not spread it or catch the virus as well as older children / teenagers and adults. So that seems to be promising. However, we don't have great information, great data on children who are in areas where there's lots of community spread, like South Florida at the moment being one of the epicenters in the world at this moment. So yes, even though we have some limited information saying that kids maybe can spread it because maybe they aren't large enough to spread these respiratory droplets to each other, having a lot of children in a community setting where there's lots of virus going around in school, we haven't really tested yet. So I think not to say the kids are guinea pigs, but we're going to learn a lot in the coming months around the country when schools reopen.
And so really what I'm seeing is there's so much that we don't know about this virus, and I hear you being concerned about that as well.
Yes, and it's unfortunate. For me, people will look to us in the medical field and in the medical field to the pediatric infectious disease world to have answers, and sometimes we're making best guess estimates based upon the information available. Some of the information changes, which is really frustrating to me as a doctor when you're trying to decide what's best for your practice, for your patients, your colleagues, what advice to give them, wearing PPE and things like that in the hospital. So it can be frustrating. I try to emphasize to people, none of it is malicious. People aren't changing rules, ideally be to serve their own good, right? As we get more information, this is a novel virus. We want to be able to spread it as quickly and efficiently as possible and do things to keep us safe, to keep the population safe, and to stop the spread of this. So I can understand why there's a mistrust of everything you hear because things change so rapidly, but unfortunately, that's what happens when you have a new virus to the whole world on a fly like this.
But I have one parent listening here is asking, how is this virus affecting newborns? When I had my baby, they didn't have a lot of answers. Are you know more now?
Hey, hey Liz, it does seem to infect newborns, not necessarily very effectively at all at the time of birth. So we're seeing very few, if any, children from the time of delivery getting infected. And even in many of the hospitals, not in the first few weeks of life. But what we're seeing is that there's a fair number of infected mothers, right? So they can, in the weeks after baby's born, spread it to their infants. Infants aren't really going to pick it up from exploring the world. Where they're going to get it is from their family, the 4-year-old sibling, uncle, people who are working, etc. So it can affect newborns. Most of our hospitalizations do occur in kids less than 4. But they're not necessarily that much sicker. We tend to hospitalize kids, certainly less than 1 year of age, for most things, not just coronavirus. And sometimes, not to say hospitalizations are unnecessary, but when we're really not sure with a small infant whether to admit or not admit with coronavirus infection, sometimes we'll err on the side of caution and admit a child. So you do see data out there that kids and little babies are more likely to be hospitalized. It doesn't necessarily mean that they get necessarily much sicker.
You have 2 daughters. You're a dad.
Yes.
Your daughters are 9 and 11. And before the decision was made for Broward, you and your wife, who's also a pediatrician, were mulling this over. What are some of the factors you took into consideration in trying to make this decision? Do we send our daughters back to school? Do we keep them home? Tell me about what weighed on your mind.
Yeah, so there were a few things. Certainly wasn't an easy discussion for us as well. You know, we both, my wife and I both work in hospitals, so we see the, 0.5, 1% of children who get sickest from pretty much anything, right? So you have that obscuring your vision. Man, I don't want my child to end up like that kid who needed oxygen in the hospital or something like that. Or have this post-inflammatory illness where they require some IV medications and have to stay a few days in the hospital, being nervous, heart inflammation. Again, very small proportion of the population, but when that's what you're seeing at work every day, that can sometimes play a role in your decision. Second part of it is selfish, I'll be honest. As many families will be experiencing at the moment, man, my kid gets sent home from school because they're ill, or I keep them home, ideally, because they're ill. How do I get them tested? Where do I get them tested? I have to wait 5-10 days for results. That's not feasible. What are we going to do in that meantime? And we're exposed to our child. I wear masks at work, I wear PPE. Fortunately, thank God, all of our hospitals seem to have enough PPE at the moment. At home, I don't wear PPE with my children, right? So I joke as an infectious disease doctor, I don't often get sick from the patients in the hospital, but when my daughters get sick, yeah, I'm sick almost all the time because they're coughing on me, sneezing on me, etc., right? So from a selfish standpoint, I don't want to be out of work for 10, 14 days waiting for the result to come back from my daughter too, right? So challenging for many people for many reasons, certainly, at the moment.
And while kids across the country are preparing to go back to class, one of the nation's coronavirus hotspots has troubling new numbers for school-aged children. Eyewitness News reporter Alexander Leslie explains what recent case and hospitalization data is showing in Florida.
In an 8-day period in mid-July, data shows that cases among Florida children rose 34%, while hospitalizations rose 23%. And sadly, the death toll increased by 1. On July 16th, Florida had a total of more than 23,000 kids under the age of 17 test positive for COVID-19. But by July 24th, there were more than 31,000 cases. And the death toll in children went from 4 to 5 when 9-year-old Kimora Lynham died last Saturday. Her parents said she had no underlying health conditions and stayed home all summer. Florida Governor Ron DeSantis is still pushing for kids to go back to school in August. He has not mandated masks there.
He and the president have failed every child and teacher and educator in Florida and put them at risk because of their reckless efforts to reopen schools.
4 months into the pandemic, the president had his strongest push for wearing masks yet, calling them patriotic in a tweet. In Rhode Island, data among children is a different story. This in part due to factors like the state's size or child population. Rhode Island has had a statewide mask mandate since April. As of Monday, Rhode Island children under 19 accounted for just over 1,400 cases since the start of the pandemic. Out of the state's total, that's 0.8%. Data shows 43 under the age of 19 have been hospitalized, meaning just 0.2% of the total hospitalizations in the state. There's been 1 pediatric death in Rhode Island.
The most common question I've gotten and my partners have gotten in the last 2 weeks is about what we should do about school. Should I send my son to school? Should I pick plan A or plan B? What do I think about school? Some of you have kids with asthma or medical health conditions, and some of you work full time, and some of you stay home and are thinking about homeschooling. The decision that you make about school, the one that you make, is the right decision. That's it. There's no wrong decision. Each decision isn't perfect. Each has risk. So this is what you need to understand. How you choose to think about the decision that you make is what will make it right. How you choose to think about it will create how you feel about it, period.
In much lower risk than they are from seasonal influenza, our kids also play the smallest role in transmission of the virus. Yet, it is our kids who have borne the harshest burden of the control measures instituted to protect against the virus. It's often asked whether it's safe to return kids to school. It should also be asked how safe it is to keep schools closed. You can bet your bottom dollar that keeping schools closed will exacerbate existing achievement gaps between demographic groups, lead to more kids dropping out of school, disproportionately impact the least economically affluent Floridians, foster more social isolation, depression, and anxiety, harm students with special needs, and deprive students of the ability to engage in sports and extracurricular activities. While the risks to students from in-person learning are low, the cost of keeping schools closed are enormous. Now, distance learning was a stopgap measure adopted at a time when there was still uncertainty about the role of children in spreading the virus. Florida did better than most states with distance learning, but let's be honest, it's a far cry from in-person instruction, and it placed a tremendous burden on our working parents. We also know more now than we did then. People forget that Florida never closed daycares during the pandemic. There's no evidence of this accelerating the spread of the virus. And the experience in other countries suggests that open schools is not a major factor in the transmission of the virus in the community. I believe we owe every Florida parent a choice to send your child back to school for in-person instruction or to opt to maintain distance learning. The evidence that schools can be open in a safe way is overwhelming, yet I also understand the apprehension that some parents may feel, and I believe in empowering them with a choice. No parent should be required to send their child to in-person instruction if they don't want to. I also believe that special accommodations must be made for all students with significant health issues who may be more at risk from the virus. I know many teachers and faculty are chomping at the bit to get back in the classroom because they know how much their students depend on their instruction and on their tutelage. We support you and want you to be safe. Safety precautions have been made for those who've worked throughout the pandemic, from everyone from working in healthcare to working in grocery stores, and I'm confident the same can be done for our educators. Now, for those teachers who may be higher risk, or even those who just don't feel comfortable with in-person instruction, they should be given the option of working remotely. Why force someone to be in the classroom if they're uncomfortable doing so? Let's just find a way to make do. And if the school district needs to delay the school year for a few weeks so that everything will be in good shape, have at it. The important thing is that our parents have a meaningful choice when it comes to in-person education. To our students, you are the future of Florida. Every generation has made sacrifices so that the next generation would have the ability to thrive. We cannot be the generation that deprives you of the opportunity to live up to your God-given potential. We can best fight the virus by having a healthy, functioning society, and that especially includes our schools. Let's not let fear get the best of us and harm our children in the process. We must stay strong, for we will succeed. Thank you, and God bless you.
There have also been few reports of children being the primary source of COVID-19 transmission among family members. That's where the data currently stands. But that being said, even if there is transmission and later studies come out, let's say, we believe that students should be going back to school because the effect on a child, we know scientifically, they are not affected in the same way as an adult.
Thank you everyone for watching Marabella's Voice. So remember to like, share, and subscribe to the channel. See you next week.